Hello and welcome to this short presentation on the Professional Support and Wellbeing Service, or PSW. My name is Rachel Armstrong. I'm a psychiatry hire trainee working in the Southwest and I'm the current PSW Fellow. So here I'm just going to give you some information about PSW, who we are, who's in the team, and what we can offer, and then also how to refer yourself if you're in need of support from PSW. And also I'll let you know about some other avenues of support that might be helpful to know about. So this is the mission statement for PSW. PSW is here to provide personal and professional support and development to postgraduate learners across the Southwest to reach their full potential and provide safe patient care. So those that come to PSW often they are bringing issues to do with what's going on in their personal lives, and sometimes it's to do with issues or difficulties within work. But very often it's a combination of both things. And PSW predominantly supports resident doctors in training, but it does provide support to some other smaller staff groups like dentists in training, pharmacists and advanced care practitioners. But they certainly have a lot of experience with doctors. So PSW is a team based within the Faculty for Development and Learner Support within NHS England Southwest. And PSW spans both the former Peninsula and Severn deanery areas. And just to let you know who makes up the team, so the clinical lead is an associate dean called Dr. Kay Spooner, and Kay is a consultant anaesthetist by background. There is another associate dean, Dr. Sarah Hewline Dickens, and Sarah is a CAMS consultant by background. And there are also 3 non-clinical but very experienced case managers working in the team. So that's Samantha Robinson, Amber Shipley and Rebecca Calvert. And all of the case managers are supported by a small admin team. So to let you know about the process for how you would seek support from PSW and then what happens after that. So first of all, you would need to refer yourself to PSW, and you do this by going to the PSW section of the websites, both in the Peninsula and Severn deanery websites, and there's a PSW section, and within that there's a huge amount of really helpful information about all sorts of different issues, signposting for different support services, and there's also, for example, a series of podcasts that's really good about issues affecting doctors. So have a look on the website generally, but at the top there is a link to click to the electronic referral form. So you just click on there and fill it out. And it is ideal if a resident doctor self-refers, because then PSW gets the most sort of accurate, up-to-date information. And also we find that doctors that self-refer tend to be more engaged and get the best out of what's on offer. But you can also be referred by your supervisor or by your training program director. And the same electronic form, electronic self-referral form, can be accessed via the QR code that's on the screen now. So then to let you know what happens next, so once we have received the referral form, you will be able to book an initial meeting with a case manager. And this meeting can be up to 90 minutes long, so it's a really good opportunity to give some proper time to thinking about what's going on and figuring out what's best going to help. And at the end of this meeting, you will have a plan of support that's co-produced between you and the case manager. And then referrals are made to relevant support resources, and I'll come on to that in a minute. And the case manager will provide some follow-up, so very often that's email check-ins to see how things are going. But if you needed another meeting with a case manager, then that can be arranged. And it's really important to know that PSW is a confidential service that's separate from your training scheme. So even if the referral is received, or if the referral is made by your supervisor or by your training program director, then the PSW service remains completely between you as the individual and the PSW service. We don't have any contact with supervisors or training program directors. And there will of course be very rare exceptions for when we may need to break confidentiality, but that would be about, having concern for your safety or of someone else's safety. But yes, it's a confidential service separate from your training scheme. And all of the meetings, so with the PSW case managers and with the people that we then refer on to, are online, which helps to make it more convenient. And in terms of where the case managers may refer you on to, so we can refer to specialists in sort of exam support and supporting people with language and communication skills. We can also refer on to coaching and counselling, and with those services you can access up to 6 sessions free of charge via PSW. So just to think a little bit about other avenues for support, but if you do need support from PSW, then absolutely come and see us. But just to let you know about other places that you might be able to go for support and things that could be helpful. So hopefully within our training programs, we have supervisors and training program directors that we could talk to. There may also be other helpful people around, like medical education managers, and they might be able to listen and point you in the right direction. Then also individuals' trusts often have their own sort of staff support systems. So EAP stands for Employee Assistance Programme. So it's worth looking at that and seeing what they might be able to offer. Then we mustn't forget that we have our own GPs that we can make use of. And you've probably heard of practitioner health, but this is a really important service specifically set up for doctors and senior health professionals who have issues around mental health problems or with addiction, and you can find them online very easily and self-refer if you need to. Then Frontline 19, so this is an organisation that provides counselling sessions to doctors and other health workers and other emergency service workers. And then it's also worth knowing about Doc Health, so they offer subsidised sessions for doctors, and the clinicians that you will see are medical psychotherapists, and they really have a long experience supporting doctors and know quite a bit about our struggles, so it's worth having a look at them as well. And there's plenty more of this kind of information on the PSW webpage, so have a look at that. So that QR code there will take you to the PSW website, and you can just have a read more about other support services. And it is really important to know that PSW is not an emergency service, so we can't respond to crisis situations. And we would suggest in that kind of scenario, you're thinking about things like this. So, to state the obvious, talking to somebody you trust about how you're feeling. There are a couple of sort of 24-hour phone support lines for NHS staff and doctors. So there's the BMA Wellbeing line and there's the NHS Confidential Staff Support line. So those are available. So Shout is a text mental health support service, so you can text that number. There's also the Samaritans, which is obviously available to everybody. And in really serious situations, it would be things like contacting your GP in hours, going to your emergency department, or calling 111. And just to mention this briefly, so this is it's adapted from Maslow's hierarchy of needs, and it's thinking about the needs that NHS staff have in order to be well and survive and then, ideally thrive in their jobs. And it's worth just looking at this, and you can find it very easily online, and doing a bit of a kind of check-in on what your current situation looks like in your workplace. And the point it really makes is that if the basic things aren't in place, so what's at the bottom of the pyramid, so that would be, being able to have time to eat and drink, having sufficient rest and being able to take breaks and get sufficient sleep at night. If those things aren't in place, at the really basic level, then the other, psychological needs and self-fulfillment needs are irrelevant, really. You need the basics in place first. And from my own experience and from others that I talk to, very often those basic things are absolutely not in place for us within our workplaces. So I guess if we're not able to have workplaces that support our well-being on a really basic level, then services like PSW and the other support services available to doctors are going to be, continue to be needed. But Just having a sort of check-in on what your current work situation looks like and how it compares to this could be a helpful exercise. So here I just want to let you know about a recent evaluation of PSW. So Kay, who's the lead for PSW, has just done a really large piece of work evaluating the service over the past 3 years. And a big part of that was a feedback form sent to everybody who had made use of the service, and that's predominantly resident doctors. And what we found was just incredibly positive feedback about different aspects of things. So people saying that they found the service very accessible, that they found it effective in the sense it was helping them with the issue that they had presented to PSW with, that it was positively impacting their well-being, and also positively impacting people's ability to keep training and keep working in the NHS. So we were really pleased with the responses. And I've just picked out a couple of things to show you from that. So this is a quote from a resident doctor who'd made use of PSW. So the PSW have been instrumental in getting me back on track and enabling me to continue my training programme and working in the NHS. Thank you. And then this here's just a little word cloud about people's experience of the case managers. So this is just really nice feedback about how friendly people found them, supportive, helpful, empathetic, kind. So I thought that was really nice. And then my final one here is just a little quote to say, someone found that this was an excellent service and I just wish I'd found it sooner. And my point here is I think doctors are really not that good at seeking help at the appropriate time. So we tend to leave it, much later than we should. So if a thought about whether you might need support from PSW or from somewhere else is with you, I would just really encourage you to make the referral. Just come and see us at PSW if you need to. So here again is the PSW referral form QR code link. So do make use of that if you need to. And I also wanted to let you know about WARD. So WARD stands for Well and Resilient Doctors. And this is an organisation run by doctors in the Southwest, for doctors, focused on well-being. And I'd really recommend having a look at their website. So that's via www.welldoctors.org or via that QR code. And they are putting on sort of well-being events. They're running a mentoring scheme at the moment, and they've also got loads of helpful information on the website. So do have a look and see what WARD are up to. And thank you so much for listening. I hope it's been helpful. If you are left with any questions about anything, or if you're not sure whether to refer yourself in or not, then please do make contact via this email address here. So england.psw.sw@nhs.net. Okay, thank you.